We come back, we're going to talk about eyesight and a striking statistic about blindness.
Now, Mark Brennan on CFAX 1070.
4:35, 25 minutes before 5, there's an organization called Fighting Blindness Canada, which is the largest private funder of vision research in this country. FBC has contributed more than $40 million in the search for sight-saving cures and treatments for people who are going blind or have eye disease. Now, concern from this organization because it says that by the year 2031, the number of people living in this country with blindness will double. Let's find out more. Doug Earle is the president and CEO of Fighting Blindness Canada. Hi, Doug.
How are you?
I'm good, thank you. Right now, let's establish what the definition of blind means, first off.
It is where you are having difficulty seeing and very low vision. So it's usually 20/80 is one of the measures.
Okay. And right now, how many people in Canada are living with some form of blindness?
In 2017, Stats Canada identified 1.5 million Canadians living with low vision or blindness.
Okay. And you're saying by the year 2031, how many might be living with blindness? It's
saying that that number will double by 2031. So currently there's 5.59 million Canadians living with an eye condition that puts them at serious risk of losing their sight. And from that group, we're expecting the number to double.
What kind of diseases or ailments are these 5.5 million Canadians suffering from?
So they're living with the early stages of age-related macular degeneration, and that sort of blocks out the center of your eye, or glaucoma that has pressure on your optic nerve, and the periphery vision narrows. You can read, you can see, type, but your periphery vision is starting to shrink. And also, if you're living with diabetes, a form of an eye condition is diabetic retinopathy, where there's bleeding in your eye, and that develops into blockage, so you're unable to see. Your retina it deteriorates, so you're unable to see. And a part of the challenge is these 5.5 million Canadians, they're not getting regular eye exams where they can detect it early enough to receive treatment. And because it doesn't infect the day-to-day, it sort of creeps up. It's invisible until that moment when you no longer can see.
So what would you like to see, pardon the expression, done, and by whom?
Well, we're calling, Fighting Blindness Canada is calling for the BC government and all governments to develop a vision health strategy where we can bring people, all the stakeholders together to develop this strategy around public education so that people will go get a regular eye exam from either an optometrist or an ophthalmologist, that we can invest in having access to the new treatments that are coming, that we can have equitable access to the treatments that exist not only today in Vancouver, but in the rural or remote areas, that there be more investment into research so that we can accelerate our discoveries and bring them into new treatment to help people stop losing their sight. And then the last call that we had is here in BC, we're training 3 ophthalmologists, 7 retired last year, and we need to increase our workforce of eye specialists in order to meet this growing need.
Do we take our eyesight as seriously as we take the rest of our concerns with respect to, checkups and that sort of thing? We go to the dentist. Most of us go to the dentist twice a year. If we have a GP, we'll get a checkup. But do Canadians generally go and say, I should get my eyes checked, unless there's a reason?
Yeah, well, that's a very good question, whether we take it seriously. Canadians are telling the pollsters that 70 to 80% of them fear losing their sight as a disability, but yet only in the 40 to 50% range go get a regular eye exam each year. So we do need to put our feet into action and get a regular eye exam with an optometrist or an ophthalmologist, and be able to discover early whether or not you have these onset of these diseases. Because research has found treatments today that if caught early enough, 75%, 3 in 4 cases, there is treatment available that will either stop, stabilize, and in some cases even restore sight, repair the damage that has been done.
So we have come a long way scientifically, medically, when it comes to our eyesight, but socially we haven't come a long way.
No, it's just like, governments asking you to wear your seatbelt or drinking and driving. I think we need to do something on vision as well. Getting your eye exams is the greatest thing you could do to prevent blindness.
And you're saying as much as 75% of cases involving eyesight loss can be preventable?
Yes, if caught early.
If caught early.
If caught early, yeah. And that's having a dilated eye exam where they can look at the back of your eye is the best way to prevent it. So if you're over 40, the standard is that you go get an eye exam every 3 years. Over 50, it's every 2 years, and over 60, it's every year. And that's because starting at age 40, the incidence rate doubles every decade. So if you're over 65, it's 1 in 7, and if it's over 75, it's 1 in 4 have developed these diseases.
I see. Okay. Well, I appreciate this information. I note that you recently changed your name to Fighting Blindness Canada. Previously, you were known by a different name. Tell us about that.
Yeah, so for 45 years, what our previous name was Foundation Fighting Blindness. We were dedicated, we've committed $40 million to research, vision research in Canada, and have made over 600 discoveries to further the knowledge of eyes and how it works and how these diseases progress. We've invested in gene therapy, stem cells, new technologies, new medications, and what we discovered was that much of our research, even though it was focused in the retina, the back of the eye, that it was having impact in all blinding eye diseases. So we wanted to invite Canadians that are impacted for all blinding eye diseases to help us fund this research, to accelerate it so that we can see these discoveries in the lab become treatments in humans.
And this,
for all of us, yeah.
This funding, where does it come from? Is this by donation or do you get grants?
No, this is by people making donations on fightingblindness.ca. By supporting, we have a Cycle for Sight ride happening in Langley on June 1st. We hold different events, and we're out raising private funds through philanthropy in order to support this research that we're funding.
Okay, well, thanks for that. It sounds like I should go back to the optometrist, and maybe people listening right now, if they haven't had an eye exam, if you're in your 40s, what it's once every 3 years. If
every
you're
3 years.
In your 50s, it's once every 2 years. 60s, once a year.
Yes.
And so
that's a preventative step not to lose your sight.
Okay, appreciate that. Thanks for your time today. Very, very interesting. I did not know that. That's good to know that it can be beaten if you discover early enough that you have some sort of eye problem and that you won't go blind. That's good to know, Doug. Thank you for this.
Pleasure.
Doug Earle is the president and the CEO of Fighting Blindness Canada.